Buongiorno a tutti, siamo a Milano con il dottor Altan che si è reso disponibile per rispondere alle domande più frequenti che vengono poste dai pazienti. L'intervista sarà in inglese e ovviamente provvederemo a inserire i sottotitoli per una migliore comprensione di tutti. So, hello doctor, nice to have you here in Milano for this interview.
Hello, my pleasure meeting you here in Milan. Thank you for inviting me.
Thank you. So we can start with the questions that the patient are always asking us in order to reach you. The first thing that the patients are interested is what are the characteristics of your FUE technique and why it's different from others technique.
The FUE technique, first of all, it means follicular unit extraction, and we are performing the operation with the motorized punches, and we harvest the hair follicles one by one, and we do it slowly. We are not in a hurry, and we do it homogeneously from everywhere in the donor area. So this is the difference from the FUT, for example, which is leaving the scar. And what is the difference from the other FUE techniques? It's not depending on exactly like the machine, but it is depending on also the experienced team who is performing the operation.
Now, regarding the patients, how you determine if a patient is suitable or not for a hair transplantation?
Most of our patients, they are coming from abroad. That's why first of all they need to send us their photos in order to check them. Of course, if they are in Turkey or if they are in a holiday or by chance they are in Istanbul, it's better that I see them face to face. First of all, I need to see the photos from everywhere, and then I first check if donor area is available for an operation. Then we check the area, what we can do, or maybe some patients they are not a good candidate for the operation, and we are telling them no.
And regarding this, how do you manage with the cases that have a limited donor area?
With the limited donor area, if it's possible to do the operation, this is also depending on how big the implantation area is. If it's possible to do it, sometimes we harvest from the donor area, what we can harvest, and then we are also harvesting from the beard hair to make the implantation. But some patients, they really have limited donor area and it's not possible to do the operation, and we tell them they are not a good candidate for the operation.
So, as you said, that most of your patients are not from Turkey, are coming from abroad. So, what's the process from the beginning? So, from when they contact you till the surgery and so on?
Our patients, they are coming abroad, most of them, and first they need to contact us to send their photos for an evaluation. And I check the photos and tell them if they are a good candidate, they are a good candidate, and they can come to Turkey for an operation. And they are buying their tickets, and then they are coming to Turkey. In the airport, they will have the driver. They are going to go to the hotel first and get some rest, and the next day we are taking them again from the hotel to make the operation. Operation is like 6 to 8 hours. It will take almost one day, and then they will go back to the hotel again, get some rest, and next day they will come for another checkup, or like we are doing the first wash for them, and then they are flying to their country after we say everything is okay, you can fly, and so on. But we need to be in touch for 1 year in order to control the process. That's why after 5 days, 10 days, and every month they are sending their photos to us for checkup.
So your packages, of course, are very clear and have a fixed price. And we know that you have two different packages, the standard package and the premium package. Can you talk about differences between the two packages, what is included, what you are doing in one and in the other one?
In between two packages, my role is not changing. I am for patients who is standard or premium. I am making the hairline, and then after the hairline, planning the operation. I see all the patients in the morning for taking the medical history. Then I open the channels for all the patients without any exceptions. But in the premium package, we use microscope to divide the single hairs. We also count the grafts like singles, doubles, triples, and so on. And if the patient doesn't have enough singles, we cut them from the doubles, and we check all the singles who is going to implant it, which is going to implant it for the frontal hairline, if they are really singles. And we need a transition for the frontal hairline, like thin hairs, medium hairs, thick hairs, and we are just separating the thinnest ones to implant in the front to create the natural look. That's why I need all my team to be in the premium operation, and that's why we are taking just one patient, because all my team should be in that operation. It's not because it's premium we are taking one patient. And then in the standard package, how we are doing it, again I designed the hairline, and we just checking them by our eyes. We don't use microscope, we are checking them by our eyes. Yes, we see if they are single or double, but sometimes single hairs they can grow like double because of better circulation in the frontal area.
For the patients that have an advanced grade of baldness, how do you manage patients with a baldness of Norwood 6, Norwood 5, Norwood 6? How do you manage the distribution of the grafts from the frontal part, the mid scalp, and the crown area?
This is depending on patient's donor area, because it's high stage Norwood, and we are checking if the donor area is available. We do one operation, and generally I choose to do it the frontal part and the mid crown until the crown area. This is better approach according to me, not to harm the donor area, not to make over harvesting. And we tell patients to come in for the second session. Okay. And in the second session, we use the donor area, and if needed, we can add beard for the implantation.
What is your target density per square centimeter in the frontal area, in the mid scalp, and in the crown area?
If the patient's circulation let me do it, we can do it up to 60, 65 hair grafts per centimeter square. But after this high density, sometimes we open just with the 50, 55. I need to lower it in order not to cause any circulation problems. And generally we start with the 50, 55, and then it will be 40, 30, and if it's going up to 30, it will be good. But if the patient doesn't have enough grafts, or if patient has some hairs on that area, because if the patient has 20 hairs, I need to add 20 in order to achieve the 40. So we decrease it up to 20. But generally it is like 50, 30, and 20.
And what kind of tools do you use for the follicular unit extraction? What kind of punch? What is its size?
We are using the motorized punch. We are not doing the operations with the manual punch. And with the motorized punch, the punch size is generally 0.7 millimeter. But for some patients, because they have thick hairs, like black hairs, thick hairs, we need to use 0.8 millimeter, because the 0.7 is too small for them, but not bigger than 0.8, either 7 or 8.
What are your criteria to decide how to make the hairline in order to look it natural regarding, of course, the face of the patient?
For the hairline, yes, this is depending on patient's face and the frontal muscles also. I am checking the frontal muscles, I am checking the patient's face from all around, the right side, left side, and then the front and the muscles. But after that, we draw the hairline, like it's a line, perfect line. The things are changing during the operation. From doctor to doctor, from professional to professional, it's changing. I try to make it a little bit wavy, and on those waves I make big and small zigzags. and they are not going to be symmetrical. They should be asymmetrical in order to be seen natural, because nobody's hairline is perfect. If I do it like a perfect line, it's not going to be natural, and hairline is the one of the most important, let's say, thing in the hair transplant.
What's your approach when you find patients with a lot of miniaturized hairs? Do you recommend to undergo the surgery, or do you prefer to suggest them to undergo medication first?
If there are like 3 to 5 hairs per centimeter square, this is balding, and we invite them to the operation. But if they have many hairs and they are just thinning, if there is a possibility to reverse them, yes, we recommend patients to start the finasteride or dutasteride if they accept, or maybe minoxidil, and they need to know they need to use it for a long term. It's not a medicine for 6 months, use it and then stop it. And after that, we see 6 months. And after 6 months, if there is a big change, we tell them wait another 6 months. If there is falling, if they are falling, if it's not working, we do the operation. If it is working, we need to wait until they come back and it is stabilized. After the stabilization, we do the operation.
And regarding this, how do you minimize the risk of shock loss when you see thinning hair?
If we already accept the patient for the operation, when I'm opening the channels, I see those little hairs and I try not to cut them. I just do the operation in between them. Because if there is already 50 hair per centimeter square, we don't do the operation there. If there is 30, we need to add 10 or 20. And it is visible during the operation. There are empty parts and we just fulfill them. In the future, if they are going to fall, maybe they will fall. But because of the operation, we are going to be careful not to cause more shock loss.
Can you explain to us how the shock loss works and why it happens?
Yes, shock loss can be happen in the implanted area or in the donor area. Both of them are caused by the circulation, because when we are doing the operation, when we are doing the harvesting, we are cutting the vessels, and when we are doing the implantation, when I'm opening the channels, I'm also cutting the vessels. This is okay because after some time they are renewing, there is recirculation. But sometimes we cut the vessels, and the follicles, they need some time. They cannot take enough blood and they are just falling. But follicle is not dying. After 2 to 3 months, generally, they are growing back again. For some operations, if you do too much, like over harvesting, you enter too much to the donor area, this shock loss is over harvesting and it is never coming back. This is something different.
What is your strategy to avoid this overharvesting and to keep the donor area in a good condition?
We are checking the donor area in the morning, that how is the density, what is the thickness of the hairs, and how much we can harvest from this donor area. And we have a guess, like from this donor area 3500 is possible. This is not only depending on what I see before the operation, this is also depending on patient's skin. Because sometimes I enter and I see the connective tissue under the skin is too hard and it's not giving us the grafts, and then we try to do a homogenic operation. We take almost same amount from all the areas, and then it's not going to become a over harvesting. We understand if we are going to go to the over harvesting, because if you harvest more than 40% of the donor area, it may cause the over harvesting, and this can be changed. For some patients it's 30, for some patients it's even over 50. But you need to have the experience to understand what is possible.
Do you also perform the hair transplant on scar tissues and what's the difference for that kind of surgery?
Yes, some patients, they had FUT before and they had a scar on the back in the donor area. It is a little bit hard to sleep it's a little bit hard to sleep with the implantation in the donor area, but we do it only sometimes if there is no circulation at all, because in the scar tissues there is no circulation. We do deep enough implantation and generally they are growing. And some patients they had brain operation. They have also very big scars in their childhood and so on. We do the implantation and they are growing pretty nice. Generally, we don't have any problem with it.
What kind of post-operative care do you suggest in order to help the regrowth and to help also the maintenance of the hair transplantation during time?
Hair transplant itself, it's not only depending on the scalp and the cosmetics, because the human body is a complete thing, and if the patient's general health is okay, the hairs are going to grow okay. So we are recommending them to walk every day 30-40 minutes, eat healthy, fresh food, do not eat any fast food and so on. And we explain them how they are going to wash it for the first 10 days, and after the 10 days we generally recommend them to do the massage when they are washing. And that's the basic things, because this is their own tissue. If their body is healthy, if their general health is okay, the hairs are going to grow okay. We don't recommend too much cosmetics and so on, buy this or do this, because they are generally not working well.
And do you suggest also some medical treatments or not?
Yes, for the patients they want to do, we can recommend them PRP, or they can do mesotherapy after 3 to 4 months. And then maybe there are some laser treatments patients are trying and doing it. It's not a must, but yes, we recommend them to do it after the operation.
And regarding this topic, how important do you think that also the therapy with finasteride and minoxidil is for a long-term result?
I think it is very important to support the hair transplant with the finasteride, especially because if the patient started finasteride 1 year before the operation, we see the hairs are getting a little bit thicker and the hair loss is stopped. So I can understand it is stopped here, it is stabilized, so I can perform the operation. But with the patients who still have hair loss, and we do the implantation for the frontal hairline or for the frontal part, and after that the hair loss continues. After 5 years, 10 years, they will have just hair in the front, and going to the back, they will be bald. This will be very weird. So we recommend them to start the finasteride if possible before the operation. If not, if they didn't start it, we recommend them to start after the operation and continue for a long time. It is going to be very nice and good supportive treatment.
Do you think that taking finasteride before the surgery can reduce in a significant way the risk of shock loss? And if yes, how much time before the surgery you should start taking finasteride?
I don't think finasteride is going to lower the risk of shock loss, because, as I explained you, it is depending on the circulation.
Yeah.
Maybe after the operation, when they see the shock loss, they can start not the finasteride but minoxidil to increase the circulation, and the shock loss is reversing a little bit faster than non-minoxidil using patients.
Are you following the new developments of hair clonation and regenerative treatments? What do you think about them? Do you think that in the future they can be something important in this field or not?
I hope it will be, because if it's possible, we can harvest just one hair from the patient and we can clone it. We can make it 5,000, 10,000, 20,000, and it will be nice to do it. But hair seems like a basic, but it is really complex structure when we are checking it under the microscope. And there are some problems building it now. And as far as I know, the doctor stopped doing the research because of economical reasons. I hope somebody will invest on it, and then the research is going to continue.
What advice would you give to somebody who is interested undergoing a hair transplant but still has some doubts about it?
This is depending on the doubts. Patients sometimes they afraid to fly to another country. They feel anxious about it. They have right, yes, and we are having a video call to meet with the patient as a doctor. I explain them the operation, and then their anxiety is going down, they trust, and then they are coming. Some patients, they afraid from the pain from the operation, because online many patients are writing we are killing them during the operation, but it is not like that actually. It is just 5 to 10 minutes in the beginning during the anesthesia. After that 6 to 8 hours, this operation, it's not going to be painful for them. And if they will have pain, if possible, we will do more anesthesia. We will be helping them. We are not going to just leave them with the pain.
And regarding Italian patients, how can they contact you to have a professional evaluation for their case?
Actually, for the Italian patients, they need to contact you first. And then after that, I will see the photos and so on. Then we will send them an evaluation, how it is going to be, what is the package, and what we are doing. So the best way is contacting Luca.
Thank you, doctor, for your time. The interview is finished. And if you want to say something to the patients, feel free.
Grazie, you're welcome. My pleasure to be here. And if they have baldness and if they have any questions, they can ask you, and you can ask me, and
Sure.
then we can do the consultation.
Grazie a tutti.
Grazie a tutti.